Hi, my name is Frank. This is my record for Assessment 3, Part 2, Verbal Defense. I will start with Worksheet 1, Muscle Acting on the Forearm. The first muscle I'm going to talk about is the biceps brachii. The origin of it is short head, coracoid process. The long head, supraglenoid tubercle node fossa. This is corrected by Natasha. And the insertion of it is radial tuberosity of radius. For the notes, the palpation of the coronoid process is somewhat impaired by the tendinous attachment, which fell through tissues. The second muscle is triceps brachii. The insertion of it is long head, infraglenoid tubercle of the scapula. The lateral head, posterior surface of the humerus superior to the radial groove, and the medial head, posterior surface of the humerus inferior to the radial groove. And the insertion of it is olecranon process of the ulna. Olecranon process is easily palpable in the elbow area. The three heads are hard to palpate due to the thick muscle tissue. The third muscle is brachialis. The insertion of it is distal half of the anterior of the humerus, and the insertion is ulnar tuberosity and the coronoid process. Those process and the tuberosity are pretty close to each other in the anterior position of the elbow. The last muscle is brachioradialis. The insertion of it is the proximal 2/3 of the lateral proximal 2/3 of lateral supracondylar of the humerus and lateral intermuscular septum of the arm. And the insertion of it is a lateral surface of the distal radius proximal to the styloid process. Radius is the bone that functions when throwing the baseball. This is Worksheet B, muscle acting on the shoulders and arm. The first muscle is deltoid. The origin of it are anterior fiber, lateral thirds of the clavicle, middle fibers, acromion process of the scapula, and the posterior fibers, the spine of the scapula. And the insertion of it is deltoid tuberosity of the humerus. Deltoids are responsible for shoulder flexion, rotation, adduction, abduction, and extension. The second muscle is pectoralis major, and the origin of it is clavicular head and sternocostal head. The insertion of it is a lateral lip of the intertubercular groove of the humerus. And the clavicular head and the sternocostal head are easier to be felt when arm is abducted. The third one is infraspinatus. The origin of it is infraspinatus fossa of the scapula, and the insertion of it is middle facet of the greater tubercle of the humerus. And the shoulder blade is a big bone in the body, and it is prominent while stretching and turning. The fourth and the last muscle is teres minor. The origin of it is upper 2/3 of the lateral border of the scapula, and the insertion of it is inferior facet of the greater tubercle of humerus. Worksheet C, muscles acting on the thigh, adductors. The first muscle is adductor brevis. The origin of it is body and inferior ramus of the pubis. Insertion of it are pectineal line of the femur and proximal part of the linea aspera of the femur. This muscle adducts the thigh at the hip joint and assists in hip flexion and aid in medial rotation. The second muscle is adductor longus. The origin of it is the body of the pubis, and the insertion is middle third of the linea aspera of the femur, which helps adduct the thigh at the hip joint and assists in the hip flexion and the medial rotation. The third muscle is adductor magnus. The origins are inferior ramus of the pubis and the ramus of the ischium, as well as the hamstring. The insertion is gluteal tuberosity, linea aspera, and the medial supracondylar line of the femur, which helps adduct and flexes the thigh, adducts and extends the thigh. Both parts help stabilize the pelvis during walking. And the last muscle is gracilis. The origin of it is body and the inferior ramus of the pubis, and the insertion is medial surface of the proximal tibia. It helps adduct the thigh at the hip joint, flexes the leg at the knee joint, and assists in medial rotation of the leg when the knee is flexed. Worksheet D, muscle of the posterior thigh. The first muscle is biceps femoris. The origin of it are long head, ischial tuberosity, short head, linea aspera, and the lateral supracondylar line of the femur. The insertion of it is head of the fibula, and this muscle helps with flexes the leg at the knee joint, laterally rotates the leg when the knee is flexed, and the long head also extending the thigh at the hip joint. The second muscle is semimembranosus. The origin of it is ischial tuberosity, and the insertion of it is posterior surface of the medial condyle of the tibia. It helps extend the thigh at the hip joint, flex the leg at the knee joint, and medially rotates the leg when the knee is flexed. And the last muscle is semitendinosus. The origin of it is ischial tuberosity, and the insertion of it is medial surface of the proximal tibia, and which extend the thigh at the hip joint and flex the leg at the knee joint, and it also helps medially rotates the leg when the knee is flexed. Worksheet E, muscles of the stomach. There are only two muscles need to be talked about. The first one is rectus abdominis. The origin of it are pubic crest and pubic symphysis, and the insertion of it is xiphoid process of the sternum and costal cartilages of ribs, number 5 to number 7. This muscle helps in flexes the vertebral column, compresses the abdominal contents, and helps stabilize the pelvic during walking. And the external oblique. The origin of it is external surface of the ribs, number 5 to number 12. And the insertion of it is linea alba, pubic tubercle, and anterior half of the iliac crest. This muscle helps in flexes the trunk and compresses the abdominal contents, contralateral trunk rotation, and the ipsilateral side of bending. Yeah, this is my verbal defense for the part 2. Thank you so much.